Welcome you guys to episode number 20. Wow.
20 of these?
20 of these we've
People must
done.
really
That
like
is incredible. We have a very, very special guest today. I'm your main host, Coach YoYo. We have our co-host as well, Coach Nik. Obviously, we have Colton, our marketing production, and special guest today, Dr. Jett. Dr. Jett is what people call you, or is it Dr.
Jett?
Jett?
You can call
I like Jett.
Doc
Jett.
Holladay, whatever.
Doc
you want.
Holladay.
Doc Holladay.
Dog Holiday. Dr. Jett. So Dr. Jett, the reason why we want you to be on here is because obviously you're an NP, right? You're a doctor. And you specialize on these peptides that around the world that people are using, especially in the US. And we're going to talk about, so here are the topics we're going to talk about. We're going to talk about weight loss shots, weight loss pills, and what are concerns that you see, and what are the things that people should be doing, you know, when they're using those types of products, right? And what you see from an NP perspective, because we see it on our side of things, and I'm sure there's a lot more going on in your world, right? So, but let's start with what made you become an NP, and how long have you been an NP, and why? Like, what's up? Tell us your story.
Okay, so when I've been an NP for about 5 years. I've been a RN since I was 2010 about. So, but I've been in the medical field for over 25 years. When I wanted to pursue my degree as an NP, I mean, there was a lot of mentors along the way, my own health issues. But when I became an NP, I was so excited to get out there and start working and stuff. And my very first job was just kind of I worked for somebody else. He had his own company going out and actually being mobile services. So we went out and seen patients in their homes, their assisted living facility, wherever they were living, right in the middle of like the beginning of COVID and stuff. And I did that for 4 months, was taking over for another NP. And I just had a whole different perspective of what that was, of being a primary care provider. I loved it. I loved my patients and stuff, but the only thing I didn't like about it is that all we were doing is going and seeing them, quick 5-10 minute visit, handing them a prescription and saying, we'll see you back in 2 weeks to 30 days. And I'm like, we're not helping them in any way. How am I helping these people by just giving them a narcotic or giving them something to mask whatever? We're not fixing. I want to know what's going on underneath and causing this so I can fix the root cause. That's how I fell into regenerative medicine. I was only with that job for 4 months. And I started looking at different options of I do medical cannabis cards for my patients. I've helped a lot of people with that. That's a whole different story, but that's how I kind of fell into looking in regenerative medicine, holistic medicine, because I don't want to use big pharma medications and just mask people's stuff. I want to figure out what's going on so they feel better and it's gone for a long time.
Which is why we want you on our podcast, because we look at the same thing. People come to us thinking they're just going to lose weight. Sure, that can be the main goal. But what they didn't realize is that we look at your blood work, right? We look at your home environment, your work environment. What does that look like? And what is your emotional connection with food or relationship with food? Right. There's a root cause of everything, right? It's not, and plus you don't just wake up in the morning and be like, I want to use the weight loss shot today.
Right.
You've been thinking about it for years, if not months.
Right.
Or maybe your cousins or your aunts and uncles are using it and they have a huge success with it, but they're not willing to make any changes in terms of their routine or lifestyle. Right. And like you said before we had this podcast, you said it's going to bounce back. Right. So I love that you wanted to look at that such a holistic way, right? Like we do. And that's why so just so you guys know, we met Dr. Jett at a company thing, and so the funny thing is, me and Nik were ready to have a battle conversations if she said something like, "Oh yeah, they can get on the shot, and they don't have to change any diet." So we were ready to have that conversation, right? And then as soon as she said no, we tell our clients that they need to change their lifestyle. So you gave them some kind of guidance, right? Do they follow it? 9 times out of 10 probably. No? Yeah. That's a no. Probably not. No. But and then we just fell in love with Dr. Jett when we first met, because we see eye to eye, and that was like we're like, dude, we need to have her on a podcast. And that's why we're here today.
Exactly.
So thank you for being on.
You're welcome. Thanks for having me.
Next question. Okay. What are the most common health issues you see in patients?
So a lot of my patients, all of my patients have already been through their primary care, their Western medicine doctors, but a lot of them are suffering. They want to lose weight. They're tired. They're fatigued. They're just at their wit's end of diabetes.
Type 1 or 2?
Type 2.
Type 2.
Most of them are like, most of them come for like weight loss and stuff. But then with weight loss, I'm looking at other symptoms.
They didn't realize that they're type 2, huh?
No,
A
lot of them don't.
We get a lot of
Yeah.
people that we get blood work and they come back and we're like, you are severe type 2.
Right.
Oh, I didn't know.
You didn't know, yeah.
It's scary.
I mean, some people avoid the doctor's office because they don't want to know, or they're, and they've gone years and years and years. And I talked, when my patients come in, I'm like, I try to get their why. Why now? You've been dealing with all of this for so long. Why now? And they're just, like, for example, my patient the other day, she's just like, I am a school teacher and I've had all these kind of issues and stuff, but I mean, and she's young, in her mid 30s, but she's just like, I give all that I have to being a teacher during the day, and then I get home and I give nothing to my family. I am tired. I'm, exhausted, and I apologize. I'm an empath. I sit and talk to people, and I'm just like, I've been there, done that. I feel that. I mean, she's just had issues with different things and stuff, but like with eating disorders and stuff, and so have I. So I can relate to a lot of people, and I have had thyroid cancer. I've dealt with my own issues and stuff. And I mean, that was 20 years ago, but I'm doing well. But you just, I wish that I would have like had mentors or like a primary care provider that listened the way that I do with my patients, because I'm not the type of provider that you come in for 5 minutes and you're not going to spend time with me. I'm going to know you. I'm going to know who you are, and I want you to trust me. So.
Wow, that is literally what we do within our organizations.
Really?
We have to build rapport.
Yes.
Not only we build a rapport, but we have to know what is really going on inside that head, right? Sure, we can look at blood work, blah blah blah. But okay, are you going to be happy with yourself,
right?
Even after you have a 6-pack,
right?
If you're not happy now, and you don't fix that mental whatever blockness you have, you're not going to be happy when you're shredded.
But not just that, but we can, like what you said, you relate to the patients based off of what they've gone through, and we can as well. I've never been on the end of the spectrum of being overweight, but I've always been severely underweight. But the body dysmorphia, the depression, the health issues, the everything I've had as well.
And he gets injured. I've known him since.
Oh my God, I broke 28 bones, 2 full reconstructive surgeries.
Because he was so skinny.
Yeah.
When every time he falls,
something breaks.
Yeah.
Okay.
We better check your vitamin D.
Oh, it was low. It's better now. It's a lot better now. But
I want it at least at 80, please.
I think last time it was about
good.
80. Yeah, I need to get it checked again. But the fact that you can relate to your patients and it sounds ridiculous, but you see them as a human being, where I feel like most practitioners, most NPs, doctors, anyone you go to, just see them as a patient.
Right.
And they don't really care about anything else aside from just getting them in, giving them a blanket diagnosis, giving them some prescription that probably isn't going to help with anything, sending them on their way, getting to the next person.
Right.
So I really love that you actually want to connect. And then I wanted to ask really quick, was your thyroid cancer, what is it, papillary thyroid carcinoma?
Papillary, yep. There's 3, I believe there's 3 levels, the highest being the medullary. Mine was papillary. And
is it a bilateral removal? Is that what it is?
They just took the whole thing out.
Okay.
Yep.
Wow.
It was still contained in a capsule and was barely starting to push its way out.
Yeah.
But the very first provider that I seen, when I noticed that it was there, it looked like I had a little Adam's apple. They were like, let's just watch it. And so I didn't know. I was 23 years old. Let's
Watch
just
it grow?
watch it and see it. Yeah, and then I had another provider a year later, and I didn't know any of this stuff. So I'm like, okay, well, I was working as an MA, and in internal medicine for this NP, which I can't even remember her name right now, but anyways, she's why I'm an NP as well.
Good.
But she was just so good about stuff. That's what they're taught to do. We can either put you on a medication to see if it shrinks it, or we can just go get an ultrasound right now. Okay. So I'm like, I want an ultrasound. I've been watching it for a year.
Exactly.
And it's getting bigger. And
thankfully it didn't spread.
Did that
Yeah.
Did that cause any weight gain, weight loss?
So I typically run around 125 or 130 at my ideal weight. But yes, it caused a lot of issues. I was so sick after. I mean, they had to adjust. I mean, I had to have radioactive iodine. I had to have my medication adjusted all the time. Then they were only starting me on a medication that had T4, which now I know you need T4 and T3.
And T3.
So I use the desiccated thyroid. But I just never was regulated. My, my anxiety, my depression, not being able to sleep.
Yeah.
I mean, but the lowest I think that I got down to was 104, just because my body was adjusting to everything. And that was not a healthy weight for me. I looked sick.
104?
Yeah. So I was 104 pounds, but it took several years to get me regulated and testing to make sure it wasn't going anywhere or anything.
Was it after you had kids?
Yes. So my second, I found out I got the nodule when I was pregnant with my second, and he's 23 now. So,
Wow.
yeah. So, but I mean, I'm good now. But I also know the functional medicine side of it, and I feel so much better getting switched over to the desiccated thyroid, and I know how to take care of myself.
Which this is good to know, because I have a client who she had the same cancer 10 years ago and ended up getting hypothyroidism from it. She had, I think it was a bilateral removal. But I think now that when you mentioned T4, I think she's only on T4. I don't think her doctors have her on T3. So I need to ask her. But we've been having some issues trying to get her to get below 190. And I'm looking at her food, and I want to get your take on this. And I'm looking at it, and I think she might be over 50 micrograms of iodine a day. And I don't know if that is an issue. And so what I did is I looked at her food. I'm like, really, the only thing you could be getting it from, aside from water, would be egg yolk. So I substituted her 2 whole eggs with the yolk for 2 more tablespoons of peanut butter. And immediately within 2 days, we dropped 4 pounds.
Oh, wow.
So do you watch your iodine intake now, or because you're doing T3, T4, and where you're at, are you not really too worried about your iodine intake?
I don't really look at it like, oh, my voice, but I look at a big panel. You guys have seen the panel that we do, so it's pretty extensive and stuff. But I mean, when I'm looking at the full thyroid, I'm checking them for Hashimoto's. A lot of providers don't do that, or they wait till it's like at an advanced level and stuff. But every patient that comes to me that's on a T4 like Synthroid, I switch them over to the desiccated, so they feel better. But iodine, I mean, I look at if it's an issue, then I'll keep checking it after. But there's also supplements that I put them on. I use medical grade nutraceuticals that I use. If they have, Hashimoto's is a different thing, but it affects your weight. It can affect everything and how you're losing it.
We get women coming in that have Hashimoto's. Yeah. And we deal with that too. And it's tough, but.
And some of them, I had a patient tell me, they told me I'm starting to get Hashimoto's, but they just said lose weight and eat right. And I'm like, there's more to it than fixing Hashimoto's. Yeah.
I wish it was that simple, ladies and gentlemen.
Okay, but how?
Yeah.
That's the thing, they don't explain how.
Yeah.
They just say, do that, and then come back and we'll talk. It's like, well,
right. But and then they're not treating Hashimoto's until your thyroid's already destroyed. We catch it right in we want to catch it right in the beginning, and then make diet changes and lifestyle changes and start supplementing and optimizing your thyroid, so we don't cause that. Because if you let it go, I mean, you're going to ruin your thyroid gland, feel like crap, possibly at increased risk for thyroid cancer.
Why do you think that is? That they wait until the last possible cycle, or they say, let's just keep an eye on it? Like, why? I mean, I get you might need to go to a specialist, right? But why is it that it seems when our clients, same thing, they go to the doctor, they have a certain health condition, or they think they might have it, the NP or the family doctor, whomever it is they go to, don't want to do anything until almost worst case scenario?
I don't understand that. I as far as when I was doing that and learning a certain way as Western medicine, that's how you're taught in school. I mean, you're not taught holistic stuff. You're not taught functional medicine. You're not taught regenerative medicine or anything like that. So when I just lost my train of thought. But anyways, when I with functional medicine and everything, and as NPs too, our jobs, and when we're going to school and nursing and just bedside manner and getting to know your patients. I mean, we're in front of the patients all the time. Yeah. But being able to get to the root of the problem, figure out and call and help with preventative instead of wait till there's
more
an issue.
proactive than
Yes.
reactive.
Yeah.
Yes.
Reactive
Yes.
is huge.
Yeah.
People, that's
Yep.
what they do. In fact, you know, when our client starts the program, we require them to do blood work.
Yep.
It used to be a recommendation. Now it's
Right.
like, no, the more we know, the faster your transformation goes.
Right.
And we're not doing any guessing games.
We
right?
can't diagnose them with anything,
can't
but we can still read it. Like, hey, did your doctor say you're type 2? I don't know. Okay, call them. Just have
Right.
them say it.
Yeah.
And then
Right.
they do. It's like, okay, now we know
Right.
what to do.
And,
right?
and sometimes, to be honest with you, depending on where they go, the doctor would fight our clients on it.
Especially
and
with
number
hormones.
one, they don't want to pull blood work on some sorts. I'm like, oh, how old are you? 24? I'm like,
No, yeah, you're fine.
You're fine.
Yeah. Are you
I'm like,
feeling sick? Well, no.
like,
Okay, then you're fine.
pull the blood work. Like,
Exactly.
I don't know why they're resisting. So I think if we can channel all of that and send them to you, that
Someone
will be
who
a lot.
cares.
Someone who actually cares.
Right.
And that will be so much easier,
Yep.
in my honest opinion. Because we had a fight with so many different doctors, and we had conversation with doctors. I had a phone call.
Yep.
With-
Arguments with him over the phone. Like, will you just check his testosterone? Well, no, he's 23. We don't need to check it. It's like, well, we need to check it. And then sure as hell, it comes back. And we had a 20-year-old who was, his total, I believe, if I remember correctly, was, I think, 178. It's like, you
I've had
should
that
be
before.
like
20.
700-800 minimum.
20.
Yeah.
I'm like, how does that even, like, is that real?
Yeah.
20. And so it's crazy. But the big question, which is why you're here, and I know a lot of listeners are waiting for this. I apologize. So let's talk about the weight loss shots and medications.
Okay.
Right. So first, before we go into that, how many weight loss shots or medications that you know of right now that is on the market is hot?
Well, the peptide shots, the weight loss, like semaglutide, tirzepatide, liraglutide, I think it's called, are very popular right now. I mean, everybody
three.
wants
Those
that.
are top three.
Yeah, those are the top three. I mean, I've heard a few of. I mean, there's other ones out there and stuff that
sure.
work, have different mechanisms of actions and stuff. But those are the popular ones right now, and that's just the big craze right now. But I like I said, I have a lot of patients that are on it. They're on it for months and months and months, and they lose 10 pounds maybe in 6 months. I mean, my goal is to help patients lose 1 to 3 pounds a week with lifestyle changes and all this. But I have patients that come to me and they're just like, I've wasted so much money and I'm not getting anywhere. But clinics and places are not dosing them correctly. They're not like tapering them up the way they should. And then when they get to their sweet dose of losing consistent, you need to stop. That is the dose that they're losing on. There's no reason to keep on going.
And what is the time frame on that?
Usually every person is different. Everybody's body works different. On average, maybe it takes them, because I start them very low. It's a taper drug, so we know how their body is handling it.
Yeah.
I start them, like, depending on the drug, say example for semaglutide, I start them at 10 units. If they do well the first week, technically you're supposed to be on 10 units for 2 weeks, 20 units for 2 weeks, but I don't follow that. Every person is different. So just because it says it in a textbook doesn't mean it's going to work for Johan or, whoever, so I go by patient. How are you doing? Are you having any side effects? Are you losing? Then we will slowly bump them up week by week, and probably by 4 to 6 weeks, sometimes people sooner. Sometimes people are losing 1 to 3 pounds on 10 units.
Just 10 units, yeah.
And so
Wow.
there's no reason for me to move them to 20, know. And so everybody, like I said, everybody's different. So we've just got to find that dose that works for that patient, and then we stop there.
Yeah.
And then they still have a lot in their vial. I mean, it's expensive.
It is expensive.
Yeah.
How much on average do you think
Yeah.
people are paying for these medications?
Monthly?
Monthly before they come to you.
So between $400 and $600 a month, I think.
Lord.
I know of places that are selling vials, the same vial sizes that I use, for over $1,000 to $1,500 for a vial.
I mean, how is that ethical?
It's not.
I mean,
It's
I mean,
not.
honestly, like, how is, and I want to bring this up because, so one of my clients, he just passed the MCAT and he is applying to med school. He wants to be a cardiologist. And I was talking to him and I was asking him, it feels like in medicine, we're at the point now where that Renaissance era has kind of come to an end, where the new, this new thing's coming out and we're seeing all these improvements. And now I feel like companies are starting to get desperate. And so it's like, well, what's the next biggest thing that we can go after and target the largest demographic? It's weight loss. So let's just come up with these, excuse my language, everyone, these fucking bullshit medications, get them out there with zero guideline, let whomever wants to open up a health clinic, open it, get the medication, start selling it. And that's how we're going to keep all this stuff going. What are your thoughts on that?
I don't like, and I don't want to talk bad about anybody, but I am not a big pharma fan.
No,
me neither.
There are just a couple prescriptions that I call in. I don't agree if you look at my pricing and stuff, I have a reward system. I keep my prices low. Like semaglutide vial is almost $900 less than what clinics are selling them for. Wow. It's very, and it's going to last them 3 months. And I'm like, well, you can get this for $697 and it's going to last you 3 months in what you paid in a month. Because I want to help more people, and some people can't afford that.
No, 100%.
Plus, I have a reward system where you can apply for a firm and make monthly payments on it. Not everybody can throw down $697 for. That's just for the semaglutide. Tirzepatide again is a little bit more expensive, but I don't believe in that stuff. And like I use medical grade nutraceuticals also. So I use supplements, and then sometimes depending on the patient, I'm like, we're getting the medication in their treatment plan, their customized treatment plan put in place. And they're like, oh, this is a lot of supplements. And I'm like, but we're doing it naturally and fixing things, and you're not getting on a bunch of prescriptions that you do not need.
But it's specific to them.
Exactly.
Right? So someone's protocol of peptides, isn't going to be the same. Like mine wouldn't be the same as his or yours.
Nope.
And that's what I like, is that you're looking at it like, yes, it seems like a lot. But again, it's not a pharmacy. It's not the typical prescription pill. Take this, and sure, it's going to help with A, but it's also going to cause all of these side effects.
Exactly.
We can keep that to a minimum.
If you're working on a patient, how often do you require them to get their blood work within that process?
So the initial blood work, because we want to check kidney function, liver function. I check their A1C, lipid panel. That's just the minimum for peptides. Yeah. Okay. Then I have the fuller big panel if they want to go forward with that. I'm sorry, what was your question again? I'm ruining this.
How often are you having them do blood work?
Oh, okay. So
these
so at least I check their blood work every 3 months.
Every 3 months.
Yeah, they should. Just the minimum ones. I don't do the full hormone panel, but just to make sure their kidney function and stuff. Yep. I've had a couple patients who were like, I'm just starting to get like kidney pain. I want to know what's going on with it. Yeah. Plus, they're checking in with me weekly with their weights. So they get their vial, they get to take it home, or they can come in. But if they're, it's more convenient to do it by yourself. So they get taught all of that stuff. They check in with us weekly. We do coaching of like how you're eating, your water intake. Are you having bowel movements every day? Let me know your side effects and everything.
Yes. Which we'll talk about that soon.
Okay. Yeah. So anyways, we just try to encourage them. That's why I want to work with you guys to help get better plans and stuff for my patients.
Because we require blood work right at the beginning, but we usually try to do it at 3 months in, and then at the end, because our program's 24 weeks. So let's get 3, minimum 2, so then we have something to compare it to, make sure we're making the progress. We're seeing if they have an EGFR issue, that it's actually being corrected. If AST and ALT are high, have they been coming down? Is what we're doing actually working? But we know people, they get blood work done once every 5 years.
And most
that's the norm.
most clients of ours have no understanding of taking some kind of medication, whether it's anxiety, depression, whatever the case may be, can cause some kidneys and liver issues, and it's super stressed out. And I'm like, hey, are you? But they didn't tell us, right? And I'm like, are you on, besides water, what else are you intaking? And then they tell us, and I'm like, oh my gosh. How are you drinking 2 monsters every day because you're tired and you're not eating? Oh my gosh.
And again, that's just masking your symptoms. I'm going to drink a Rockstar, a couple of them every, it's just a lot of stuff.
Well, people tell us that, and we're like, well, are you feeling okay? Do you feel good? And they're like, well, yeah, no, I feel good. Like, I don't feel anything wrong, but they have nothing to compare feeling good to. So once they go through the program and they start eating right and they're drinking the water, they're moving, they're sleeping, stress management, a couple months into it, they're like, holy shit, I felt horrible back then. And I didn't know. Like, well, now you know what feeling good actually is.
So I have a couple of questions before we get to that. I want to ask this one, right? So what are your specific requirements that patients have to meet before you will prescribe them with any weight loss medication or peptide?
So we have consents and everything that they have to fill out.
Yeah.
Requirement, blood work. They have to have a BMI greater than 27. I mean, there are some with, there are peptides help with PCOS. So I have some patients that are below 27 and we just have on a maintenance. But, the thyroid, you can't have a history of thyroid, medullary thyroid cancer. That's the most aggressive kind.
Okay.
Has not, as far as I know, has never been proven, the studies that I've read, to cause that in a human, but it has been shown in animal studies.
Yeah.
So they just want to precaution that.
Yep.
Also, any history of pancreatitis. They
Okay.
can't have type 1 diabetes.
Wow.
Can't be pregnant.
Okay.
So, and if you became pregnant on it, you would need to stop. And the recommendation is to wait to get pregnant 6 months to a year, just because there've been birth defects and stuff in animal studies. So semaglutide, I mean, I've had patients that are like, oh, well, my friend was on semaglutide or my sister was on semaglutide and then she got pregnant. Well, she did lose weight. Her blood sugars went down and everything in her body was getting healthier. So she got pregnant, but she had to stop. But it didn't make her get pregnant.
Yeah.
It just fixed her body levels to, so she was healthier too.
Which, and that comment reminded me, I did see an article, I think I saw it on LinkedIn, I wish I would have saved it, talking about people using these weight loss medications as fertility treatment.
I can see that because you're fixing like your A1C,
exactly.
you're fixing the insulin resistance and everything. Because GLP-1s this is what I tell my patients too. Not only like, for instance, example, I have a patient that we're fixing it to help her not only lose weight, her PCOS, because she doesn't want to be on metformin.
Yeah,
I would prefer metformin over a GLP, I mean, excuse me, said that backwards. I would prefer the GLP-1, which is semaglutide, tirzepatide, over metformin.
Yep.
Yes, they do a lot better on it. Plus, they usually have like high cholesterol or, different issues. Their cardiac CRP is high. They've got inflammation in their body. Semaglutide and GLP-1s have studies that show that it decreases cardiac risk. It cleans out like the plaque in your arteries and stuff. So overall, it's like helping like lower your A1C, lower your cardiac risk. Sometimes it's good for people to be on it for a while, a long time. I mean, it was originally made for type 2 diabetes, side effect being weight loss. Yeah. But they've found all of these studies that there's so much more benefits to these GLP-1s.
Do you have requirements for A1C for them to be on? Like if they meet everything but A1C is like 5.7?
No, because you don't have to have type 2 diabetes to still have weight issues. Yeah. So yes, I have a lot of patients that are on it and lose that. I mean, it just only improves it.
Exactly.
So yeah.
But
I like
that.
I love that. Thank you for sharing that. What is the difference between semaglutide, Ozempic, tirzepatide? Do you know what are the difference with that, right?
So,
and why choose one or the other? Yeah.
So semaglutide is a GLP-1 receptor agonist. So your pituitary gland tells your pancreas to release more insulin, which lowers your blood sugars and slows down gastric emptying. The tirzepatide is a GLP-1 and a GIP. So it's a dual receptor agonist. Okay. So it works stronger in the body.
That's a stronger version. Okay.
So if my patients come to me and they've been on semaglutide before in another clinic and they've gotten nowhere, and say they were up to 70 or 80 units, which is a high amount. Max is 100 units.
Wow.
But if they're up,
is this a day?
Yep, a week.
A week.
Once a week shot injection. But if they've been on semaglutide before, then I'm happy to transition them to the better GLP-1. I typically have never started anybody on the higher one because your body's got to get used to it. Some people do great on semaglutide. Some people don't. So I've got to transition them up. But we always start with the lowest one and work our way up if we need to.
Is there any kind of waiting period that they have to go through? Like they're on semaglutide, they come to you, you're going to put them on tirzepatide. Do they need to be off of semaglutide for a certain amount of time before, or can they just go
can just switch
one
over
week
to that
they're
next
on,
week.
the next week they're on a different one? Okay.
Yep. And then But tirzepatide, then we're starting at the lowest dose and tapering our way up, because you're with the semaglutide, they have 2.5 milligrams and 5 milligrams. I typically use the 2.5 milligrams, and then we can bump them up if need be. But you're starting at a higher, like, for instance, if I started at 15 units of tirzepatide, they would be basically on 3.3 milligrams, because it's a 15 milligram or 20 milligram per ml.
Okay.
Semaglutide is 2.5 or 5 per ml. So it's quite a bit jump up, and it's stronger. So yeah.
Wow. That's huge.
That's good to
a
know.
big jump.
Yeah.
Yeah, that's good to know, because we had no idea.
We just see all these names getting thrown out of these different weight loss medications, and it's like, okay, are they all the same thing, just a different name to trick you into wanting to getting on?
5 years from now, there will be some new shit out there. And I'm like, oh my gosh! And it's like, it's a hot thing to do, and I'm like, stop doing that. Our program has literally been the same for years, and it works. That's because we changed our lifestyle.
I mean, I have patients that come to me who are like, will you prescribe me phentermine? And I don't like phentermine. I don't, it is a stimulant. Yeah. Because that's a popular one. It's a stimulant, basically. It's it's a amphetamine salt. So you're just, it's not good for your heart. Yeah. It's just,
and
I mean,
think of going, right?
Yes.
Yeah, it's scary.
And I've had patients who are like, I've been on it for 6 months to a year, and they've never been monitored. That's a drug that you have to be monitored, like,
oh my gosh,
at least every 90 days. And in my opinion, to see if they're having any cardiac issues, tachycardia, palpitations, anything like that. But they're not getting monitored. They're not having blood work done and stuff like that. So I don't like phentermine. I don't do that. I mean, I just
who's
think
prescribing this, and just like, okay, have fun, bye. Like,
a lot of
see
people
you never.
do. So
some doctors just prescribe stuff. In fact, we had this conversation with, I had a guest on my Instagram live, and she's been in the fitness industry for a long time, and she on live was like, I'm going to tell you something, yo. And I'm like, okay, what's up? Because we're talking about doctors and how are they willing to help patients to lose weight.
Right.
And she flat out said, she goes, some of these doctors, if not all of them, have no idea what they're doing in terms of actually helping their patient to lose weight.
Right.
Besides giving them some sort of medication, metformin, phentermine, whatever the case may be, or semaglutide or Ozempic. And she says, I've worked with so many doctors, and they have no idea. Sometimes we look at their blood work more than their doctor.
Right.
And I'm like, hey, did you notice this and this and this? And I'm like, no, my doctor doesn't say anything because it's optimized, because it's within range. I'm like, dude, you're like 1 point above.
Right.
That's not normal.
That's not normal.
No.
Right? And you tell me, okay, you tell me the testosterone's median range from 250 to what, 900? I think that's such a big, so people get so confused. So when the doctor sees it, oh, you're 255, you're 25 years old, you're fine.
You're normal.
35,
you're within range.
You're within range.
It's like,
Well,
so?
here's the big aha moment for a lot of my patients. Just because you're within range does not mean you're optimal. So that's a huge, I mean, when I talk to my patients about lab work and stuff, I'll spend a half hour with you going over that lab work.
Yep.
I've had doctors where just send me my lab work. Everything looks great.
Yep.
Watch this.
Repeat that first part of that sentence one more time. Just because your lab is within range does not mean you are optimal. Listen, y'all listening to this? Go get your blood work done, guys. Come on.
Perfect example. I got my testosterone checked for the first time years ago, and my total was, I think, 567 or something like that. But my doctor still wanted me to get on testosterone because I was having symptoms of low T. And she said the same thing. Sure, you're within a normal range, and that's a pretty good range for your age, but the symptoms are saying we need to treat you for it. So we did.
That's good.
And I feel like a freaking human being again.
That's good. I was just at a barbecue last night, and one of my friends'
Thanks
husbands.
for the invite, by the way.
Next time. Anyways, we were sitting there talking, and he's in his 30s too, but he's tired, and I think he said his testosterone was like 439, and it started at around 300, and he's like, I'm so tired. I have all of these symptoms and everything, and his doctor refuses to put him on anything.
Yep.
And I don't know if you guys have ever met my husband or not, but we started pelleting him about 4 years ago, and I have several men that I do, but we started pelleting him 4 years ago. Like the way that he feels, and his, I think, was around 500 and something.
Yeah.
So when I do bioidentical hormones, when I pellet you, and we can go over that later, but 5 weeks later, I check your labs, and goal for men on their testosterone is greater than 1200. So he likes his around, everybody's optimal is, all of our optimals are different.
Yep.
So you can put 20 people on a line. Optimal is going to be totally different. What feels good to you doesn't feel good to me, you know, if we're women and stuff. So he likes to be higher, but he works out like 3 or 4 days a week, and people think he's in the gym all 7 days a week, and his muscle mass and the way that he can gain muscle and keep muscle and be thin.
And recover.
Yes. And his libido is through the roof. Like he's just like, oh, I feel like I'm in my 20s again.
Yeah.
And you have to have your optimal testosterone. Just because it says 900 that doesn't mean that stops there.
Nope.
And the hormones that I use are bioidentical. So they're plant-based hormones. They're not synthetic. Yeah. They are put underneath the skin. They bypass the liver and gut access and go right to your cells where they need to be. And you feel phenomenal.
Wow.
Like when you get synthetic testosterone injections and stuff, there's a roller coaster effect. I get a shot, I feel great. Then you crash, you got to wait for the next one. Yep. This is a steady stream of hormones where you feel so good.
Yes.
I mean, I have people come in and they're just like, hey, everybody else said they could help me. Let's see if you can help me. And I'm like, just give me a month and you're going to feel like a different person. And they come in tears. They're like, I didn't even know what it felt like to feel good again. You know, and because when we're all of us, when we're about 30, your hormone levels start going down percentages by year. And they're just like, oh, well, that's just natural aging. Well, you don't have to, you can fix that, you know, or I don't believe in hormones. I don't want to get on hormones and stuff. Our bodies and brains need hormones. I mean,
we die because of lack of hormones. You need these.
And fats, ladies and gentlemen. So don't cut fat out in your diet.
Can you explain that again? So you mentioned it's not a synthetic like shot. So how is it that they would, if somebody was on testosterone, how would they take it?
So I do,
it's plant-based, and
they're
elaborate
little
on that?
pellets that are compounded in this great compounding pharmacy in Texas that I use, but it's Avexapel is the Avexius Healthcare Solutions is the company I use. And I've used several different bioidentical hormone companies before. But these guys are so much better. They compound with triamcinolone, so it decreases the risk of infection and scarring and stuff. But you just get a little incision in your flank for men, and then women in their bums. And then you put the pellets in there, and they slowly absorb over the next. Typically, men 4 to 5 months they are pelleted, and then women are about 3 to 4 months. Yeah. Okay. So
speaking of testosterone, since we're on this topic, let's talk about that really quick, right? Yeah. So. You explained very well on the men's side of things. Let's talk about the female side of things, because in fact, I would say 50% of our female clients are actually on pellets, on HRT, or they're on the shots. Okay. Testosterone shots, microdose, right? So what are the numbers you see on the women's side of it? And because I know there's a lot of female are asking about this, well, I don't want to get on this testosterone because it's going to make me look like a man with the jawline and facial hair.
I'm going to get a mustache and an Adam's apple.
Yeah, Adam's apple, blah, blah, blah. So can you please debunk that right now?
And then can you also elaborate on the different side effects between synthetic? Because I was on synthetic and it didn't happen to me, but I know like there's like testicle shrinkage, hair loss because of DMT production and things like that. Is there like a difference between pellets and...
Yeah. So to start with the women, I mean, before I started doing any of this, 5 years or so ago, I had no idea that my testosterone mattered. But just like men need, so testosterone obviously is more dominant in men. But women, I have to, talk to them about it. We're not trying to make women men.
No.
I mean, we're not at all. I mean, they get a tiny, tiny dose compared to men. I mean, men get like 12 to 15 pellets. Women get like 2. and they're little tiny ones. So I have to get that misconception of like, we're not trying to make you a man. We're trying to make you feel better, sleep better. Your libido will come back. Your muscles, you know, you'll be able to, you just won't be tired anymore because I mean, like mine started at 18. Mine is like 280 when I get my pellets. And then that's what I have a high level and then I just slowly taper down and you feel like a rock star, honestly. Like you feel so good. And so when I'm getting close, I used to get pelleted every 4 months. Now I'm going to 3, little less testosterone more often because I don't like that down slope of like feeling like that. But women need testosterone just as much as men. Men need a little bit of estrogen, just like women do. But to answer your question, with bioidentical hormones and stuff, I have supplements that I put them on. Like I always check their DHEA. You can't fix like one thing and not fix the other. So I fix their DHEA level. My DHEA levels for women goal is to be between 200 and 250, men 300 and 350. Now again, I like mine higher. So it just depends on the person. But those are the goals. And a lot of patients suffer from adrenal deficiency. They're tired all the time. And then they usually have low testosterone too. So we're checking all of that to make sure we're optimizing it all. But I put people on estrogen and DHEA because testosterone does aromatize over to estrogen. So we don't want estrogen dominance with men. Because I don't use testosterone. Yes, you need it, all the health benefits of it, but you want that healthy balance of both. So estrogen helps keep that, or it's DIM in it. That keeps that healthy balance of stuff. I don't think I've ever in the 5 years that I've been doing this put any man on an estrogen blocker because that's just a misconception as well.
We get a lot of people who do that, and I'm not a fan of estrogen blockers. One, because we need the estrogen, right? But I see too many people, especially men, who get on it and then they start having cholesterol issues. And that can cause a lot of issues, even if you're doing 1 milligram a week. It's like if you have an estrogen issue, maybe lower the dose, or let's look at other options and see what's going on. I don't think AI blockers need to be used right off the bat. Or I've seen guys, it crashes them. I had one guy who was on it for so long that when we got his blood work back, his estrogen was less than 5.
Really?
I'm like, that's bad. We got to fix that.
I have some white papers from the company that I use that I can send you on why we do not block testosterone in men. The only time that I would, and it has not happened yet, block estrogen or put them on an estrogen blocker is if you came in and you had so much estrogen dominance because you're not taking your DIM, but you have so much estrogen dominance and your nipples are hurting and you're crying.
Yes.
You know,
so I know.
That's when fun. I will put them on for a week, 2 minimum. That is it. And then they're off and then you take your estrogen.
What about treating them for SHBG issues? Like, do you notice men, especially men, when they come in with low testosterone, they have higher SHBG?
Usually my SHBGs are low.
Really?
And then when they're low, that shows you that they have insulin resistance, metabolic syndrome, cleaning up their diet, adding CoQ10. I mean, you really can't change that number. That's just usually when I optimize hormones and stuff, that may change by 10 points, but not by
What about
by
in women? Because the other day, our other coach, Des, I was looking at one of her clients' blood work, and her total testosterone was low, but SHBG was really high. So I'm like, you don't have enough free for these to bind to.
So their testosterone and their hormones are getting bound up in that sex hormone binding globulin, so it's not being distributed properly. I've seen patients that have women with PCOS, undiagnosed PCOS, with things going on with that.
And I asked her that too. She's like, I don't know. I have no idea if I have that issue. I'm like, well, you might, because that's not normal. So if you see that, do you just treat them for the testosterone and you're just going to see it balance itself out?
Yeah. So I have an algorithm with the company that I use. We put all of it's based on height, weight, symptoms, all of their labs. Wow. I mean, I don't just come up with this number. I mean, I use an algorithm to figure it all out. And usually that I have a patient that her sex hormone binding globulin was 122, testosterone was 40, and I believe her DHEA was 24. Algorithm showed that she had PCOS, which she knew she did. So that's why, and then PCOS patients still need a little bit of testosterone, but not much. You give them a little bit, you put them on all the other supplements and stuff. And we also added GLP-1 because that helps with the PCOS symptoms and insulin resistance. And then is also going to help her lose weight, which overall is going to fix the cholesterol, everything else that's going on with her.
What about fertility issues? Because I know that being on synthetic,
That is actually my very next
lower
question.
sperm count.
fertility.
So
Yeah.
for men and women,
Yep.
right? So for let's talk on
Not
the male
women.
side of
No.
Not women.
Not women.
Doesn't do anything to women.
Okay.
Men, yes. So if you are young and you are still in your childhood aged range, like you're trying to have a family,
Yep.
basically. And I always ask my young patients that. I mean, I have patients that I pellet that are 24. Ideally, I want you to go get a sperm count so you know where you're at.
correct.
But if you start getting pelleted and stuff, it may really or lower your sperm count, so it could be harder to get pregnant. So it may take, and then say if you're actively trying to get pregnant, I have that conversation with you, then we're not going to pellet you.
Is
we're
it
not gonna do-
reversible if you've been pelleted and then like later you get
It
into a
could take
relationship?
6 months to a year for your sperm count to come back up.
And I think that's pretty normal for synthetic as well. It could take,
Yeah.
like I was told, it would take
Yeah.
about a year if we, so if you
Yeah.
wanted to get pregnant, it's like, hey, like next summer,
Yeah.
and then you would get off.
So I do educate my patients on that if they're at the young age. I mean, if I have a 65-year-old man or a 60-year-old man, we are not having that conversation.
Yeah, of
Clearly,
course.
they're probably not having kids.
Of course.
I mean, but I
Hopefully.
I like to joke around with my patients
Yeah.
and stuff. I will jokingly ask that, and they're like,
Yeah.
"Yes, we're done having kids,"
Yeah.
But my 24-year-old, he's just no desire, and I just document it all. They refused a sperm count. They have been educated. They want to move forward with this. It's their choice.
It's their choice, 100%.
He feels like crap because his testosterone's
Yeah.
430
at 24 years
at
old.
24
Yeah.
years old, and now he's like lost his belly. He's working out. He looks so
He's
much
happy
better. Yes,
for no reason.
Yes,
He's
And
Wakes up
he's
happy.
just-
You're like, why
Wakes
the hell
up
am I
happy.
happy?
and
You're mad
every
that you're
time
happy.
now, I think we've pelleted him twice now. He feels so good, and he's just like we have the same conversation every time. Got a girlfriend yet? Gonna have a baby? Girlfriend, fiance, married yet?
They always
Yeah.
say no until they meet someone. and
Exactly.
then-
I'm
Hey,
never
by the
having
way,
kids.
yeah.
Yeah.
So
Yeah.
so for the young men who come in and they answer the question, yes, we are going to want to have kids. Do you then instead look at things like HCG injections, doing Clomid, like horny goat weed, zinc, vitamin C to keep
Yep, if
sperm
somebody
count
came
up?
in and actually wanted to get pregnant, and yes, we can put them on Clomid if
Yeah.
need be and stuff.
Still try to treat testosterone a little bit.
Yes.
But
Because that's
not
what
sacrifice
I'm
fertility.
on. I'm on right now. So me and Jess, my wife now, are actively trying.
Yeah, so
And
Clomid would be
I
good.
had to reduce my T level to 125 milligrams a week, and that kicked my ass. I feel like, I'm not gonna lie, I've been feeling like crap for a while. I just not let it hit me
Right.
emotionally, and then Clomid every day, and then HCG as well. So
Okay.
it's been definitely working because I got my sperm
Yeah.
count as well, and I saw that number, and I'm like, whoa. we
Clomid
gotta
is
fix that.
also can be used to treat testosterone, but it's for fertility mostly, right?
Yeah. Well, and
Right.
correct me if I'm wrong, but it was primarily designed for women fertility. Is that
As
correct?
far as
'Cause
I know, but
yeah.
yes.
And then men can take it because
Yes.
my wife and I, we had to do IVF to have our daughter.
Okay.
And so I had to get off my testosterone completely. And I was on 10,000 IU HCG a week. I was doing zinc, horny goat weed, ashwagandha, vitamin C, the Clomid, and I was taking a couple other pills. And I mean, it took a while, but we got my sperm count up to the point where we were able to, we went to Spain and did the fertility out there.
Oh, cool.
It's a hell of a lot cheaper. The States is a scam to do it, by the way.
It's a lot expensive.
But, yeah.
Here. But I wanted to go back to the whole testosterone thing for men, right?
Mm-hmm.
Because there's a lot of people out there that don't want to get on it because I'm like, well, what if I can't? And I always
Well,
have to
to
tell
circle back to that, I think a lot of people also, like I mentioned earlier, if you can touch on that again, get worried by the side effects. Like they don't want to lose their hair, or
Right.
there's like the taboo stuff, like your testicles will shrink, or you'll grow like man boobs when you're on it and stuff. And that's obviously probably excessive amounts unmonitored.
100%.
That's what I was going to say.
Yeah.
Yeah. If they're not monitored, they're using synthetic stuff, anabolic steroids or whatever. I mean, that's going to mess. I mean, if I have a young man that comes in and he's got low testosterone, and you shouldn't, I mean, ideally you shouldn't, have you been using anabolic steroids? Because that will drop your testosterone count.
Yeah,
and
it
everything.
definitely drops
Yeah.
for sure.
Yep.
And so back to the women. So it does not affect their fertility at all. So let's say 30-year-old, right? Women that want to get on it because they're feeling like shit, blah, blah, blah. They get on it, and then a year or two later, they want to get pregnant. So do you take them off of the pellet?
Yeah,
point?
we would just stop pelleting them
Yeah.
at that time. Yes. But there are studies, and I can send them to you, that like I've had patients ask me about like hey, I'm still breastfeeding, but I'm 7 months, postpartum. Can I do pellets and stuff? And there's a study that I need to send you, and I can't even remember the doctor's name right now, but that it does not pass into the breast milk enough to affect them. So, I mean, I would recommend waiting 6 months to a year, but some women just feel awful after that. Your body, it takes a couple years for your body to recover after that.
I mean, my poor wife, we're only 2.5 months postpartum, and she's doing a lot better, but I mean, you can still tell
it's
the hormone fluctuation. Yeah, she's tired. I mean, the body changes. It's incredible. I
commend these women, but I don't know how you have women back to back to back, and you've got 10 little ones, or 10's excessive, but it is Utah. Yeah. But 3 little ones under 8 or 10, you know, that's crazy to me. I mean, your body needs time to recover, and those women that are out there having 20 babies.
Baby machines, baby factories. So let's say somebody comes in and they have maybe some symptoms of lower hormones and things, but they don't want to get on something like you guys kind of mentioned briefly. I'm trying to make sure that, because there's a lot of medical jargon going on, that there's a little bit of like, for people that don't understand. So like, let's say somebody's on, like they have a low, like if it was me and I had symptoms of low testosterone, or even I checked and I was low and I didn't want to get on it. What you guys mentioned, would you look for this or that? Or if somebody wanted to get pregnant, what are some of those other things? In like layman terms, like what are other options for people to kind of get on? Obviously you're not going to be optimal, but even to take something to like get raised up,
try to naturally do it.
And then maybe you guys can elaborate too, like, because I know that exercising, like we talked about last time, specifically training your legs can raise testosterone. You're not going to go from 400 to 800, but you might go from 4 to 450 or something like that. So what are lifestyle changes? Like, so we've been talking a lot about medication. How does this all circle in? So if you're on medication or you don't, and you want to take something, and exercise, food, like how does that all kind of tie in?
So, I mean, that all ties in together, but if people don't want to, I mean, I give my patients a lot of education, and I'll tell you about a book that you can offer too. But so we can fix their DHEA levels, which will help the other levels.
And what kind of levels do those affect? Like, if besides what part of me would I feel that in? Like, is that being tired, or you know what I mean?
So DHEA sulfate is the one that we check. So on top of our kidneys in our back sits adrenal glands that releases cortisol, releases DHEA and different things. But DHEA is a really strong anti-inflammatory hormone that a lot of people don't look at. So it's going to help all of your other hormones work properly. It helps with mood. It protects. There's been studies that show you if you have, women, I don't know the exact number, 25 to 50, not women, but women and men, just depending on what their levels are. If they take it, it increases your bone strength. It decreases the inflammation in your body, and it helps with adrenal fatigue.
So that hormone helps your body recover. And what you're doing is giving the patient something to give that hormone a boost to work more efficiently, essentially.
Yes.
Okay. Can DHEA affect libido in women?
I think it can if it's really low. Yeah. I mean, I've seen some numbers where they're so low, and I'm like, how do you have libido at all? But they're like, it's not that bad. So, but it'll eventually catch up to you.
Well, maybe it's because they don't know, like they're so used to it.
Yeah.
They think that's just normal. And then they get treated, and they're like, hey.
Yeah. Because I don't remember what it feels like to be when I feel like when I was 20, but that's how, when you get that feeling back, you're like, oh, this is what it feels like to feel good again, and it's like the curtains open, you're like, oh, this is life again, and you feel so good. Yep. And I get excited for my patients because you're going to feel so good in 5-6 weeks. I'm like,
I want to tell a story, and I'm pretty sure my dad listens to these podcasts, and I don't think he's going to care if I bring this up. I was talking to him the other day, and he's going to be 60 in September, and his testosterone has never been below, I think, like 600.
Oh, wow.
And he's not on anything. He doesn't take Clomid, no injections. He just doesn't like that stuff. He just eats his food, plays soccer twice a week, goes to the gym. I want to look like him when I'm 60. And he was telling me that he was talking to some people, and he was told that the way he feels of feeling good, still having a sex drive, a libido, and all these things is not normal because he's almost 60. And I get it, because not everyone is taking care of themselves the way my dad is. He's not doing anything special. He's just eating clean and going to the gym. He's just active. But even he was just like, what the hell does that even mean? That I'm not normal for feeling good? Is it you're not normal for not having a libido? And being 60. He's like, I get you're not going to be a kid. Like, that's fine. But why should you not have a sex drive? Why should you not be feeling this way? And so I just found it interesting that there's people out there now who are saying, oh, you feel good? That's not normal.
because
What?
they don't know what it's like
Yeah,
to feel normal.
it's confusing.
Or to feel good.
Yeah.
I mean, that's the normal
Yeah.
to them is just a lot of my patients too are just like, that's just part of aging, you know? And I'm like, well, I want to feel good while I'm aging.
Exactly.
You know?
Yeah. I don't
You know?
want to be old and decrepit and
Yeah.
just gross, can't
Yeah.
move and no libido or anything. And it's the women saying that because their husbands don't have a libido.
Yeah.
So it's saying, oh, well, my husband doesn't have it, so that's how it's supposed to be. You shouldn't be having this. He's like, but I do. So
Yeah.
maybe your husband should go get checked. Go get blood work done.
I wouldn't. I mean, that probably is rare,
Yeah.
but I mean, that's amazing.
Yeah.
I mean, we could get him a little higher than that.
Yeah.
Just
Which I've talked to him. He's like, no, I'm not interested. I'm
try-
fine. I'm like,
We
okay,
try.
Dad.
We're like, hey, just so
Yeah.
you know, you feel great now, but we
Yeah.
feel
Right.
like 1,000.
Yeah.
You know?
I mean,
So, yeah, he's
75 years ago when there were no, I mean, pellets have been around for, you know, in the 60s, I believe, but, you know, when there were no hormones and stuff, women were going through menopause or different stuff, and they'd get through menopause and they were only living into their, you know, into their 60s, you know, not living to 70 because they were dying of heart attacks, strokes. Everybody suffers from Alzheimer's and dementia, or broken bones. I mean, that's, if you want to do it naturally, that naturally is broken bones, you know, stroke, heart attack, and having Alzheimer's and dementia. But you can protect yourself and your brain and your heart and your body by optimizing your hormones, because our bodies need that to function properly.
So I was going to actually ask you about that. I'm glad that you kind of mentioned it. Do you have any information, or do you know, is it one of those things where more people are just being treated these days for hormone issues as opposed to before? Because even like little things I've noticed, like even 20 years ago, they didn't know a whole lot about like anxiety and depression or medications. It's all fairly new. So it obviously wasn't treated. You know, do you have any information on that? Like, do you think that maybe it's like lifestyle, processed foods? Like, do you think there's anything in particular that's driving people's hormones down as opposed to, you know, managing a more, not optimal, but managing a more, you know, healthy,
Naturally.
Yeah.
natural
Well,
level?
I mean, you do see it a lot more, but look at our society. America is the most unhealthy country in the world. There's fast food on every corner. Utah is known for the soda things on every single corner.
I've never
I hate
understood
seeing
that.
those.
I mean,
and
those lines are
crumble
so long.
and cookie
Exactly.
places. Yeah.
I mean, and when people come to Utah, they're like, "Wow, you're that state," or I've gone out of state and stuff for work and everything, and you're like, "Oh, you're that state that has all the cookies and the drink places." Yeah.
I had somebody come
Yeah.
visit from Arizona and they go, "Oh my God, you guys have So Delicious." Like,
Yeah.
we've
Yeah.
heard
I
about
don't
it. We've
even
seen
go.
it on TikTok or whatever, but this is also crazy. So I had a customer when I sold cars. He was telling me that the average Subway restaurant, after a full year, once all the employees are paid, everything is paid, food, whatever, they make about $200,000 profit every year. Crumble Cookie makes $200,000 a month.
Oh my gosh.
Yeah, compared
Yeah.
to Subway.
And I'm sorry, y'all, those cookies are not good.
Yeah. They're
not
They're way
good.
too sweet.
It's
I'm
too
not-
sweet.
I'm not-
They're
I'm not a
too
big
sugary.
fan. Yeah, I'm not a big fan because I'm not a sugar person.
So I mean, just
anyway.
think about that though. It's like Subway,
Yeah.
and then a cookie place makes 12 times the amount of money.
That's crazy.
That's what our society in America has, you know, that's what we are.
That's what we've
And
done to
it's sad.
ourselves.
And that's why our hormones are all a mess. And that's because not only our environment, but our lifestyles. I mean,
100%.
nobody cooks at home anymore like they should. Nobody knows how to meal prep. I mean, nobody
Oh my God,
takes
we
the
get that
time
all
to
the
do
time.
that. You know,
Well, when am I going to have time to do that? It's like,
Yeah.
well, when you sit down to watch Dexter or whatever you're watching on TV, instead of sitting down,
Yeah.
just stand up in the kitchen and cook.
exactly.
You
Yeah.
have
Or
the
you could do
time.
both at the same time.
Exactly.
I don't know.
Or invest in meal delivery.
Oh yeah.
Like it's
Exactly.
not. I've calculated it out. With the cost of inflation and food now, it's not. It's more, but it's not much more.
Yeah.
Like I spend about $90 to $100 on food for a week, and it's about $130 to have it delivered. So,
Well,
But there's always an option.
there is. It's just, again, it's a lifestyle change. Like you have to, I mean, have people like you guys to show them how to do it. I mean, but, and for people to motivate them, like with my patients too, I talk to them weekly, I motivate them, and I'm like, and even in my consents and all the paperwork, this is a you know, slow and steady wins the race. I mean, we're not trying to lose weight quickly. We're not trying to do all that stuff, but they, you know, and some of my patients were like, you know, if you just cut out gluten, you know, if you cut out, well, how did you do it? You know, because I in the last year, I've lost 50 pounds. I mean, I was busy and life is busy, you know, and I got up to like 180 and now I'm down to 130.
I was going to say, you do look
Thank you.
leaner today than the last time we saw you.
Thank you.
actually.
Speaking of being busy, do you think that's also part of the problem? Because I think over the past maybe
stress?
10 years,
Stress.
hustle culture is a real thing.
Yes.
Like basically, all, you know,
So
when social
annoying.
media was starting to boom, it was like if you're not working 14 hours a day, like you're a loser kind of
Yeah.
thing, right? So I
Lack
think-
of sleep.
Yeah, so
Yeah.
when people
Cortisol
are like,
levels.
they're like, I don't have time to meal prep. It's because they're working at least 8 hours a day. They have kids and they got soccer practice or whatever. So by the time they get home, it's 8-9 o'clock, and you're exhausted to cook anyway, even if it only
Yeah.
takes. You know,
Well, and then
20
Utah. I mean, I'm probably in other states. I've only been from Utah, but soccer moms, baseball. Your kids are busy. Your fast food is just the way to go. I mean,
Because it's quick, simple, and
yeah,
easy.
and I try I mean, we do eat out a lot. We try to eat more healthier stuff, like, and McDonald's is just not a thing, you know, but it used to be when I was young. My older kids, we went to McDonald's all the time. But what I don't do it now. I mean, once in a great while,
Same.
but all in moderation, right?
Yeah, stress, poor eating, things like that can cause a rise in cortisol. Cortisol makes it hard to sleep. Cortisol also, from what I understand, while you're sleeping, testosterone is what kind of goes through and like repairs your body and stuff while you're sleeping. But if your cortisol is high, your testosterone spends the whole night trying to combat the cortisol so that you can relax. So it doesn't really get to repair anything. So that's why people will sleep all night, but they won't get any rest. Like you'll be asleep, but you're not recovered.
And you're tired the next day, and you're so sore from, especially when you go to the gym and they're not.
I mean, you've even said too, like clients, you know, they'll drink their water and get better sleep, and they'll drop like 5 pounds in a week just from. I mean, it could be just water weight, but still, just from sleeping better.
Less inflammation as well. Yep. But yeah, these are all great topics of conversation, because we can talk about testosterone
all the time
for 5 hours, or if not more. But let's go back to the weight loss medications, right?
Okay.
The question that I have here: what are some of common misconceptions around weight loss medications?
That it's a quick fix, that you don't have to do anything else with it. You don't have to change. Well, yeah, you don't have to change your diet. It's just my miracle shot that I'm going to get and lose all this weight, and I can keep doing what I'm doing, eating the way I'm eating, not increasing my activity. I'm not increasing my protein.
Yep.
You know, those are all things that I go over my patient. I'm like, this is not a miracle drug. This is a kickstart. And like just a bump to get you going and motivated.
Do they feel like they can be on it forever? The same way you can be on like an HRT forever?
Some people do. And I do have some patients who stay on like a maintenance dose because it's good for you. It's going to keep your blood sugars low and stuff. But you can, gosh, my voice. And you can get on a maintenance dose to like 1 or 2 a week, or excuse me, a month. Or I have a patient that just does once a month, or I have nutraceuticals that I push them over onto that has still the capability to lower blood sugars and create satiety so you feel fuller faster. But we still, I teach them to stick. They're constantly, they probably get tired of me telling them every week, like, are you doing this? Are you doing that? Are you doing, because I'm only eating 30 grams of protein a day. Well, you can't do that. You've got to up it.
You're malnourished.
Which is
now.
where we would like to come in.
Yep.
And help some of your patients with that side of things, so you don't have to worry about what they're eating. That's our job, right?
Yeah.
So you focus on their hormones. We all focus on optimizing their meal plans and stuff. Game over.
Yeah.
Do you deal with patients that come in and they're basically starving themselves and they're like, I'm not losing any weight. I only eat like 500 calories a day.
Yep. I have patients that are like, I'm so tired with this. I'm like, been on it for a month. I'm so tired. I'm losing weight, but I'm so tired. Well, what are you eating in a day? Well, I'm not hungry, so I'm not eating. Well, this is not crack.
Yeah.
You have to eat. Yeah. And I don't literally say that, but I'm like, this is not.
You might as well.
Yeah. But really it's not. You have to eat. If you, on these GLP-1s, if you are not eating and getting your nutrients and your vitamins in you, you will be tired because your body is going to think it's starving. It's going to like take whatever it has, and then you're just going to be exhausted.
And you're malnourished.
Exactly.
But
You're
at that
too
point,
skinny.
it's going to start using muscle tissue.
Yeah, and then
to
you
break
start
down
losing
versus
lean
fat.
muscle mass.
Yes. Which remember, eating less food does not mean you lose fat. You lose muscle tissue. It is easier for the body to pull calories from muscle tissue when it's in a severe deficit than it is with fat. So you have to eat your food, plain and simple.
Yep.
Well, how do you combat that then? Because a lot of these medications are appetite suppressants. So how do you help, or at least just, I guess encourage patients, like, you need to eat, you're not going to feel as hungry as you normally would, but you still need to find a way to be getting the food in. Do you get people who it's not that they just choose to not eat, but they do have a difficulty eating because of lack of appetite? And how do you combat that?
And we really try to like protein. Like I don't like to eat a lot of meat and stuff, but the protein, but they're also like, I don't want them just to go out and get any protein. There's good proteins that you need to get. And then we really like look at like 1 gram of sugar or less. I just had somebody ask me the other day, we're like, how do you do it? What do you do? It looks like you've lost more weight and stuff. But I don't simple carbs. I don't eat crumbles. I mean, if I have a soda, yes, I still have soda. I have a diet soda or a zero soda, you know, because I'm not going to, if you cut yourself so thin where you just are eat nothing, you're going to fall off of the diet plan you're on. You're just going to fall off the wagon. It's okay to have that scoop of ice cream if you wanted. It's okay to have this stuff, you know.
But it's moderation. It's not the excessive consumption of it.
Or like cut out carbs, you know, simple carbs and stuff, and cut out gluten. It's just all in moderation. It's a lifestyle. Do one thing at a time, and we'll work up.
Don't go from 0 to 100.
Exactly.
Exactly. And that's so the one thing that we preach our clients with this. There's no such thing as bad food, but there is such thing as better choices of food.
Exactly.
Right? McDonald's, pizza, burgers, and fries, they're not bad, but over-consuming those things, right?
Exactly.
And so we actually, the way we help our clients, and I currently have one on semaglutide right now. Obviously, it suppresses their appetite, but she still managed to snack. So to me, that doesn't make any sense. It may not work for her. She might be on a low doses of some semaglutide and might need to go up or transition to
tirzepatide.
Yeah, the other one. But at the same time, we're like, okay, well, you can't eat more than 1,500 calories, whole foods anyway. So let's see if we can manage between 12 and 13. At least you're eating something good, so your body get the nutrients from that. But what happened is what she was doing is she was on the shot, managed to lose 15 pounds in 12 weeks, but she was still eating just the same thing that she's always been eating and still snacking and still, you know what I mean? And I'm surprised that she managed to lose that much while eating that, right? But again, so for us, we help them, guide them, hey, let's eat some normal foods. It's okay. I know you're not hungry. Okay, let's do a snack instead. What kind of snack? Healthy snacks that we can do. So I think that's such a big part of while using the medication, because people just stop eating. Or they continue to eat the same thing that they did.
Yeah.
Right.
They go into the clinic, they get the shot, and then they go across the street to In-N-Out and get a burger.
Right.
And
What are the side effects?
That sounds good though.
What are the side effects on these medications?
So side effects, semaglutide I've found has more side effects than tirzepatide. GI side effects. If you're not eating well, you're not going to feel good on GLP-1s. If you're not eating good, if you're eating fast food, greasy food, spicy food, eating late into the evening, your stomach will not feel good. So some people get nausea, vomiting, constipation, diarrhea, headaches are common.
Wow.
Not as common as like more than nausea. If that's why we start you at a very slow dose and taper your way up, so we see how your body's reacting to it. But you have to eat healthy or you're going to feel like crap on it. So those are most of the things. But tirzepatide has less side effects. But I mean, I can put you on Zofran and we'll just work with your diet and stuff.
Yeah. So everyone has a different side effects.
Some people don't have side effects at all.
Yeah, because one of the side effects that was mentioned to me was constipation.
Yep.
And I'm like, really? And
so we talk about increasing your fiber. And if you're not every week, are you having bowel movements? I mean, I put them on a fiber and make sure they're eating better fiber on, like I use super aloe, a Cape aloe, if you or not if you're having issues with bowel movement. And they're like, oh, I had a lady that just said, oh, I go like one or twice maybe in 2 weeks. That is not okay.
I'm twice a day guaranteed. As soon as I wake up and like before I go to bed.
Yeah, most men do that.
Most
men do that.
Yep.
Yeah, but I'm like, if you're not having a bowel movement
That is
greater than
scary.
2 or 3 days, you better be telling me. So, I mean, it's not all about, I just drink my water all day. You have to get those calories in. And then I want to work with you guys, but right now my patients have like a 12-hour eating window where they eat for 12 hours and then they fast just water for 12 hours because I don't want them eating past 6 or 7 o'clock because you feel like crap. I mean, you're bloated and all this stuff. But
have you gotten people who they worked with you for, let's say 3-4 months and they're on the GLP medications, they lose the weight, they're happy, everything's good, they leave and then they come back and they say, hey, Dr. Jett, I just gained all of that weight back?
I've had a couple, not many.
It's probably more lifestyle related though.
Yeah.
Yeah, because
Yeah.
you just go back to the same lifestyle.
Yep.
And
So
because this is a lifestyle change,
Yeah.
you have to make changes for long-term success.
So that
down the road.
segues into my question actually that I was going to ask is we've talked a lot about what you would qualify somebody to get on it. And I know everyone's different, but what are things that you look for to, because I know you said it's temporary, but we never really talked about what you would look for to get someone off it or what getting off of it looks like. Do you just stop it? Do you do you kind of, go back down,
Great
you lower the
question.
dosage and whatnot? So what would you look for to qualify a patient as, hey, you know what? I don't think we need to take this anymore. Your lifestyle's changed. We've lost the weight. How do you get someone off?
What is your graduation process?
Yeah, because I
That's a good
know
question.
that when you get on it, it kind of increases a lot of things to help with lowering, and so obviously when you get off it, it's going to lower some of those other, like
Right.
what you said, some of the glands and stuff like that. So what do you do to kind of combat getting off of a weight loss pill?
So you don't like if I take an injection and I can just stop taking it next week and be done. But you're going to notice the increased appetite and everything come back. But usually if we're taping off, they hit their goal. They want to come off. I have some, those supplements that I talked about that we can put them on, or they can be on a maintenance dose of 1 to 2 injections a month for a few months. And some people like that better and they don't want to take the supplements that I offer. It's cheaper if you do that and transition off of it. But staying on the same supplements, they're always welcome to call me after and just like, hey, what am I doing wrong, or whatever. But
So there's
it's just a
always
slow taper dose. There's several options.
So there's always something to do. You don't just like cold turkey.
Yeah.
It's not like, hey, let's lose some weight and then I'll
Yeah.
never see you again. It's like,
Yeah.
hey, we can put you on this or some supplements. It might not be as effective as the whatever medication they were just taking, but something to kind of regulate and maintain what they've been able to accomplish.
Well, go ahead.
And on top of that, while they're on it and you coach them through better eating habits, they should be able to keep those pounds off. You may gain a few pounds back, but at least you're not gaining 30 pounds that you just lost.
Well,
Maybe 5.
Yeah,
you
because
know
when
what I
you're
mean?
healthier, I know Nick posted something about this too. It's like when somebody grows more muscle mass, your body uses like, what was it? It was like more calories or something
The
like
more
that.
muscle mass you have, the more calories you burn.
more
'cause
calories
have
you
to
burn.
keep that muscle tissue, right? And so if you are trying to add muscle tissue, or even if you're trying to lose fat, you have to eat more food, and you have to replace what you're losing in the fat mass with muscle mass. And the only way that can happen is if you exercise. So people take these shots and they don't do anything, or they take the shots and they eat but they don't go to the gym. It's like you have to have some type of resistance training to add muscle mass. And adding muscle mass doesn't mean, especially for women, that you're going to look like Arnold.
right.
And we get women who say that all the time. Well, I just don't want to look bulky and I don't want to look like this. It's like, well, aren't you carrying around your toddler all the time and bringing groceries all the
have
time?
a strong upper body.
Yeah, you're having to pick up all these things to do that. Do you look like Arnold or any of the bodybuilders?
Right.
No.
Okay.
Think about
We're
that.
not
Yeah.
even there
Holding your
Come
baby
on.
all day, and then your husband holds the baby for 5 minutes. He's like, "Oh my god!"
Which I was telling that to my wife
Yeah.
the other day. She's going around the house doing stuff, holding our daughter, doing all stuff. I hold her for 5 minutes, and my back is hurting, my arm's cramping, and I'm like, "This is embarrassing." I'm in the gym all the time, and
funny.
I can't hold an 11-pound baby.
I love that you get to join us on the podcast. In fact, if you don't mind, we would love to have you in this podcast in the future for specific, one or two specific topics in medical or any NP side of things. But just so you guys know, if you guys have any questions about weight loss shots or blood work, whatever the case may be, you can shoot us a DM, send us an email, or message Nick or myself. And for the next questions that we can gather for you, if we can do that, that would be awesome.
Yeah.
That would be great.
The
You could
last
do like a story post or something.
Get questions
get
from
questions.
specific questions. That people
specific
have.
questions. Yeah, we'll do that. Any other topics that you want to review? Because we're closing in 10 minutes. Any other topics that you want to share that people need to know, or something that within
I
loss.
just want, I have a lot of patients that come to me. I just want you to know that a lot of the clinics are not like, how do I say it? Like, a lot of my patients are not getting put on the right dose. So you're just wasting money you're paying every month, and they're not dosing you correctly. They're not showing you when to stop. They're not showing you how to eat. I mean, there's just a lot more to it than just going in and getting a shot. And also like, I have patients who just want to do just the GLP-1 peptides or something. I will always look at underlying issues. If you're not losing weight in 4 weeks, or you get the hormone panel, you get it, but I don't want to do any of that. I just want to do just the weight loss. Okay. But in 4 weeks, if you're still sitting at your same weight and nothing's changed, something else is going on, and we're going to look at it. That's why baseline labs are so important. So I can show them stuff in the beginning of like that. Because if you have a thyroid issue, if you have hormone issues, imbalances and stuff, something else is going on, you're not going to lose weight. And I'm just at this point wasting your money if I am doing you and myself a disservice if I don't teach you that.
Yeah.
Right.
So,
same thing with our program too.
Yep.
I mean, we tell them the same thing. Like, look, we can't burn the calories for you.
Exactly.
We can't meal prep for you, but we can teach you how to do that. It's gonna suck. Don't get me wrong.
Yep.
I don't like to meal prep, but I still do it because we know the benefits of that. We don't like to go to the gym. Are you kidding me? Like, people are like, oh, you must love go to the gym. Like, dude, the gym is literally the last place I would like to be.
Right.
But I know what happens after.
Exactly.
We feel good. We gain muscle. We can eat more. We can have a donut here and there. Does not affect us because we have the calories to burn it. So
Well, I have a question I want to ask, and we don't have to name names or anything.
Okay.
But what are some red flags that you want people out there to look for when they go into a health clinic to try to get on these medications? Like, what are some red flags that say, do not go with this company? Is that, whether it's they just want to put you on the max dose of any of these medications, they don't bring up lifestyle stuff that you need to change. Because we talked earlier before the podcast, there's a lot of places out there who are just like, oh, you want semaglutide? Okay, it's $900 a month. And just come in every week and I'll inject you in your shoulder and we're going to call it good.
Yeah, that's ridiculous. If they're not talking to you about lifestyle change, if they're not talking to you about, let's see, I lost my train of thought.
or like unhealthy approach to weight
yeah,
loss.
I mean, it's not a fix it. If I see on the freeway advertisements of like, quick, you don't have to do anything. You just come get your shot. You don't have to do anything. It's going to change your life. That's not true. Don't believe all that. And I mean, and if they're charging you over $500 a month, that's too much money. Over $300, $400 is too much money.
Yep.
I mean, you can tell, especially when you have a conversation with, am I going to like you as a provider or am I not?
Right.
How are you going to connect with it? You can just, are they there for your money or do they really want to help me?
Yes.
Yeah.
And that is
So-
that's the biggest feedback that we get for our company. Because I actually had one, Scotty, and he was, I was coaching one of my clients, and he was actually happens to be 22 years old on Clomid because he was low T, right? And I asked him, like, hey, why did you, I never asked you this, because I like to ask this with all of my clients, because we like to know for business purposes. And it's like, why did you decide to pick us versus any other coaches that you had a consultation with? Because he had like multiple consultation with other coaches. And I know their prices are way cheaper than we are. Right. And then he said something, well, I resonate with you. I connect with you a lot easier, and you care because you see there's a passion in helping people to lose weight or gain muscle,
Right.
where other coaches, they just did it.
Fix.
It's a quick fix. Hey, I can help you lose weight this many months.
Yep.
I guarantee you, if they say a word guarantee,
They
you
guarantee your
lose,
promise,
Exactly.
run.
you run for the hills, right?
Which really good. I want to bring up, I'm not going to name names, but I was talking to someone on the phone the other day, and they said that they were a former client of mine. And they were at their gym working out a few months ago, and this kid came in who's getting ready to compete in a bodybuilding show, looked good. Everyone was telling the coach there that he was working with how good he looks, this and that. So my former client went and talked to him just to have a little, just wants to see, hey, well, maybe can you help me get to the next goal that I want to go to, which is fine. You don't always have to work with us. There's other coaches out there, right? Find who works best for you. But he did a consult with this coach at this gym. And the guy told him, yeah, I can get you to look just like him. You're going to have shoulders, abs. Like, I guarantee you're going to look the way you want. You're going to look like a Greek god, blah, blah, blah. But he doesn't do nutrition because he says he doesn't know nutrition, so he's not going to touch it. That's up to his clients to figure out. But his program, just to come in and pretty much show you how to do a bicep curl, $4,500.
Wow.
So all I'm saying is this stuff can be expensive, but that's why it's important to do consults, not just with, coaches like this, but with nurse practitioners. Find out, or doctors, whomever, is what they're offering in line with what my goals are, and do I see myself working with them? If you don't, do not pay them the money, because then you're going to be stuck. You're going to be even further behind on what it is you're trying to accomplish, or they're going to put you on a program or, medications that you don't want to be on, but you're too shy and too afraid to tell them no, that you're just going to go along with it.
Right.
So meet with a bunch of other people. If we're not the best fit for you, that's fine. If Dr. Jett's not the best fit for you, that's fine, but find someone who is.
Right.
Right.
Speaking of, where can people find you
Yes.
online? Where can they contact you? And then also, I know we talked about some mostly weight loss, but what other services do you provide? Downstairs, you mentioned that you were mobile. You can go do blood work. You're 24/7. Like,
Yeah.
what is it that you do besides what we've talked about?
Yeah.
So I specialize in regenerative medicine, integrated medicine, which is a holistic approach about stuff. I do functional medicine. I also do stem cells, PRP treatments. I do IV therapy, bioidentical hormones, and I have aesthetics and stuff that I also do.
Wow.
And then, all of that with the consultation and blood work and stuff comes with a customized treatment plan for you. I refer you to people that I work with, such as yourselves. Yeah, that's pretty much it.
And then you said you're mobile too.
Yes, I can be mobile. There is a little bit more cost to that, but yes, we want to be convenient to people. I'm not going to go meet you in Vegas or anything, but locally, yes, I'm mobile.
Do you have a website or email that people can contact you directly, or Instagram, or any social media?
Yeah, my social media, my website is www.hozhowellnessutah.com.
Got it.
It's Hajon Wellness. It's a Navajo word that means being living in peace, health, harmony, and being one with the university and taking care of yourself and stuff.
Are you
So
Navajo?
I'm half Navajo.
Okay.
And
Awesome.
my dad's white. My mom's full-blooded Navajo. And I just, the meaning behind that word is like, I've always had a dream of like, I'm going to open that because the meaning behind it is so good. And just like being one with the universe and yourself and the beauty, and seeing more than just the beauty, and you see so much more. But anyways, that's basically what it means.
I love that.
It has a definition of on my website, but website's still in the works. But I also have a rewards program where you can get on my rewards program, and I can send you that website. But I have a small studio in Eagle Mountain that I work at, and then most of it's by appointment only. But yeah, mobile stuff is good too.
Awesome.
So we'll make sure to have contact information in the bio, and we'll share as we're posting stuff about this, so that way people can get in contact with you.
Okay.
Yeah.
Perfect.
Awesome. Well, thank you. This is our time for the podcast. Again, we would love to have you on in the future.
Oh, yeah.
I mean, if we're going to continue to work with each other in the future, I would love to have you come in, once in a while.
Okay.
Just to have whatever topic that you want to talk about. If you have a specific topic that needs to be addressed,
Something comes up, you're like, we need to talk about it. Let's go.
Text me, and then or Nick, and then we can put you on. Because I love this podcast has nothing to do with making money. Just so you guys know,
No.
And the reason why we have this podcast, I don't know if you know this, Dr. Jett, is because we put our clients in our podcast so they can share their story and how they got from point A to point B, because everybody has a different lifestyle, different jobs, different, 2-3 kids versus 5 or 10. Right. And so when they share their journey of it, and people can connect.
Right.
And so we want to do the same thing with you, where you can come in and people have whatever issues, whether we talk about thyroid issues, testosterone issues, we can always talk about, because there's people that can really get educated and understand what to do with their health. So
Well, and they have
thank you.
questions, and they don't know who to go to ask, because when they go to their normal doctor to ask, they won't answer it.
Well, they feel patients feel unheard. Like they don't hear me. They don't
Yep.
connect with me. They're just, I'm in there 5 or 10 minutes and I'm out. Or here's your blood work. See you later.
Yep.
Or
Sometimes
So-
they don't get the blood work. They're like, no, everything was fine. Well, can I get it? No, you don't need it.
Oh my God.
yeah, when my patients come in for their consult, you get a copy, I get a copy. We take notes
Love it.
together.
I love it.
So
Perfect.
Awesome.
This was a good episode. Thank you
Yes.
for being
you're
on.
welcome. Thank you for
so
having me.
much. Yeah,
Thank
we love it. Absolutely. So thank you guys for sharing our podcast, sharing our YouTube videos, and our reels on social media as well. Again, this is something that we're really passionate about, and we want to share our knowledge, not just to keep it for ourselves, because the more we can teach you guys to live a healthier lifestyle, that's what we're all about. So thank you, and on to the next episode.